Hello and welcome. Welcome to our channel IMAHRKMI. If this is your first time here, please subscribe to our channel. Follow us for professional content on mental health and relationships. If you find this video helpful, like it and share it with others. Your support helps this message reach people who are suffering silently. My name is Dr. Inayat Ullah. I am a medical doctor. I am a psychiatrist and a certified sex therapist. For many years, I have worked with individuals and couples. People come to me with mental health struggles, sexual difficulties, and broken relationships. Today, I am addressing a topic that is rarely discussed openly. Yet this issue silently destroys thousands of marriages every year. Today's topic is persistent sexual refusal in marriage. Before we continue, I want to be very clear. This video is not about blaming women. It is not about attacking men. This video is about understanding a serious psychological reality. A reality that is misunderstood, ignored, and often denied. In my clinical practice, I see the same pattern again and again. Couples come for help when it is already too late. They come when emotional damage has become severe. They come when resentment has replaced affection. They come when one or both partners are emotionally checked out, and almost always we find the same root cause. Years of untreated sexual avoidance, years of silent suffering. Let me say this clearly. This is not just a bedroom issue. This is not about frequency. This is not about performance. This is a mental health issue. This is a relationship survival issue. When intimacy collapses, the entire marriage suffers. Sexual refusal is not always verbal. Many times it is silent. Sometimes it sounds like I am tired every night. Sometimes it looks like agreeing to sex without emotional presence. Sometimes it appears as crying silently after intimacy. Sometimes it feels like shame, guilt, or disgust afterward. Sometimes the body tightens without conscious control. Sometimes touch and grossness are avoided completely. Many husbands tell me this. She never says no, but she is never present. She feels far away. That absence is not coldness. It is psychological shutdown. It is the nervous system protecting itself from perceived danger. In many cultures, women are taught harmful beliefs. They are taught that sex is something men take. They are taught that pleasure is not for women. They are taught that desire equals immorality. So marriage does not reset the mind. Fear does not disappear overnight. The body remembers fear. The nervous system remembers threat. Men are also taught damaging beliefs. They are taught that desire equals masculinity. They are taught that rejection equals humiliation. They are taught that emotional pain equals weakness. So men stay silent, and silence turns into anger. This creates a painful reality to wounded people, sharing one bed without understanding each other, without language for pain, without tools for healing. Many women never receive accurate sexual education. They do not know their own anatomy. They do not know that arousal takes time. They do not know that pain is not normal. Instead, they know fear shapes the nervous system. You cannot relax in a place your mind perceives as unsafe. Trauma does not vanish after marriage. The body remembers. It remembers forced touch. It remembers painful first experiences. It remembers humiliation. It remembers being unheard. Even with a loving husband, the body may still react. Muscles tighten, breathing changes. Pain appears, anxiety rises. This is not refusal, this is survival. Vaginismus is real, it is involuntary. It is not defiance, it is not disobedience. And most importantly, it is treatable. Yet many women are never diagnosed. Instead, they are blamed. They are called difficult, they are called cold. This causes secondary trauma and deepens marital wounds. Mental illness reduces desire. This is a medical fact. Depression numbs the body. Anxiety keeps the system alert. When shame is added, intimacy becomes terrifying. Sex becomes something to avoid, not something to enjoy. Chronic rejection damages identity, damages self-worth. Men often feel unwanted, they feel invisible. They feel ashamed, they feel confused. Over time, anger replaces vulnerability, but anger is not the root. Unprocessed grief is unspoken pain is. I treated a couple in a 7-year sexless marriage. They survived legally, but emotionally, they were strangers. Treatment required time and professional care. Trauma therapy, sexual education, gradual exposure, emotional rebuilding. Healing was slow, but healing was possible. When this issue is ignored, damage continues silently. Emotional divorce happens first, physical separation comes later. Infidelity becomes more likely, resentment becomes permanent. These are not moral failures, they are clinical failures. Failures of early intervention, failures of awareness. Healing requires safety, healing requires consent. Healing requires education, healing requires emotional repair. Sex therapy is not about performance, it is about connection. Connection without fear, connection without shame. If you are struggling, you are not broken. If your marriage feels distant, you are not alone. Help exists, healing is possible. You can contact me or my professional team, visit our official website, or reach us through our Facebook page. You may also attend our online educational workshops. Please subscribe to our channel, like this video, and share it. Follow us on YouTube, Rumble, Instagram, Facebook, Twitter, and TikTok. Subscribe on all platforms, like, share, and support our content. Click the notification bell so you never miss an update. I will return soon with a new vlog. The full written article of every vlog is available on our website.